Welcome. This is a short lecture session on drugs acting on gout.
Gout is hereditary metabolic disorder, specified or characterized by overproduction of uric acid, which in turns deposition of monosodium crystals into synovial tissues of joints, causing acute arthritis, and response is seen by LTs, PGs, and migration of neutrophils into inflammation site. LTs, PGs, neutrophils which are inflammatory mediators, cell lysis characterized by generation of oxygen-free radicals, biuret crystals. Classification: uric acid synthesis inhibition, allopurinol, neutrophils migration inhibition, colchicine, inflammation, and pain inhibition, NSAIDs, enhancing uric acid excretion, probenecid, and sulfamyrazine. This classification is based on mechanism of action. Now, let's discuss on individual drugs. And now, allopurinol. Mechanism of action: inhibits uric acid synthesis via inhibition of xanthine oxidase. Xanthine produces uric acid by xanthine oxidase enzyme. Pharmacokinetics: by oral administration, 80% of drug is bioavailable and binds to plasma proteins. Excretion by urine, plasma half-life is 18 to 30 hours. Adverse reactions such as hypersensitivity reactions, nausea, headache, GI distress, and etc. and drug interactions. Half-life of probenecid is increases and potentiates. And enhanced rashes with ampicillin. Uses: gout, treat kidney stones. And colchicine. Mechanism of action: interrupt monosodium urate crystals deposition, in turn, decreases leukocyte chemotaxis. Pharmacokinetics: orally administered, binds to plasma proteins, undergoing enterohepatic circulation. Excretion through urine. Adverse reactions: GI disturbances, bone marrow depression, peripheral neuropathy, and myopathy. Drug interactions: enhances CNS depressants. Cyclosporine caused myopathy with renal failure patients. Then, probenecid. Mechanism of action: inhibits active reabsorption of uric acid from renal tubes and promote excretion. Pharmacokinetics: absorbance by oral administration, plasma half-life 8 to 10 hours, binds to plasma proteins, excretion by urine. Adverse reactions: GI upset, skin rashes, and etc. And then finally, sulfamyrazine. Mechanism of action: inhibits uric acid reabsorption at PCT. Pharmacokinetics: absorption through oral route, binds to plasma proteins. Plasma half-life is 1 to 3 hours, metabolism by liver, and excretion through urine. Contraindications: patients with peptic ulcers is not given. Drug interactions: sulfamyrazine and warfarin actions are inhibited. And end of the session. NSAIDs is continued in next session. Thank you for watching. If you find the video useful, like and subscribe.